Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Associate Professor of Nursing at Salisbury University and host of the program. Our topic for this program is substance abuse, alcohol addiction. And my guest today is Dr. Judy Jaruzinski, and you're a faculty member at Salisbury with me in the nursing department. And of course, this is one of your areas of expertise as a psychiatric nurse. And I'm so happy you could come in today and talk about this very important topic. And we're hoping to make it a series of some kind.
Yes, it's my pleasure. It's a problem that has been with us for a long time.
And alcohol, of course, of all the various substances that we'll address hopefully down the line in other programs, is one that's legal and very prevalent in our society, yet we know there's many dangers and consequences of drinking, especially to excess in various forms. But I think first thing I want to talk about is, what do we call it now? It seems like the lingo has changed. We used to call it alcoholism, or he's an alcoholic, and now we're trying to be politically correct, and there's various terms. So I was hoping you'd help clear the air on that. Is it alcohol abuse or alcohol dependence, or we say they have a problem with drinking? And you said there's actually different meanings to those terms.
Yes, some of that is attached to the DSM-4, which is what physicians use, a diagnostic statistic manual that helps them to diagnose a patient who has some of the signs and symptoms of alcoholism or alcohol addiction. We do say alcohol addiction, but we are also familiar with the term of alcoholism, which is a term that was developed really by early researchers, for instance, Jelinek, because they identified alcoholism or alcohol addiction as a disease. And that's what allows us to treat it as a medical disease. But let me kind of start by saying what alcohol abuse is. And alcohol abuse is a maladaptive pattern of use that causes impairment and stress. So when you are drinking, this is more than drinking once in a while or at a party or with friends. This is drinking that is becoming problematic. Your husband or your wife or your children, loved ones are starting to talk to you about it. People at work are beginning to notice it, or you yourself are missing days of work, or you're rushing in late because you've been drinking all night, or you continue to drive even when you've been drinking. So that's alcohol abuse. Now, alcohol dependency, and dependency, when we talk about drugs, this is when we're looking at those kind of things that are happening and you continue to drink or use. So elements of alcohol dependency are withdrawal. That means when you stop drinking, you begin to have signs and symptoms of withdrawal.
And so that's the physical addiction
Absolutely.
piece.
So when you look, sometimes I like to look at those old movies, and they're drinking these martinis, and they say, well, I'll need the hair of a dog, or I need to have a morning eye opener. That's really about withdrawal, is treating some of the symptoms of withdrawal, that when I begin to shake, or I'm feeling very anxious or nauseous, or I'm having some night sweats, those are symptoms of withdrawal. And that's why it's imperative that individuals go to a treatment center. But I know we're going to talk about that later.
So you're like putting it along a continuum and saying there's just occasional social drinking where there's no problem. Mm-hmm. Then you have people that have alcohol abuse where they're starting to have problematic patterns of drinking.
Yes.
And then if that progresses, then it can be dependence where you have the physical symptoms of when you don't drink.
Yeah. And that's a good way to put it, because then you begin to see things like withdrawal, and you begin to see another word we call tolerance. And basically tolerance is the more you use, the more you need. The more you need, the more you use. And that only means that you begin to use more just to get the same feeling, just to get the same sensation of feeling comfortable or feeling disinhibited, whatever the reasons, or being able to go to sleep. Whatever the reasons that initiated that drinking in the first place, now because of tolerance, you need more and more just to go there. And then eventually you need to drink just so you don't feel bad. So that's that continuum that you speak of.
And isn't that the case with many addictive substances? The more you use, the more you need. And
Absolutely.
Okay.
Yeah, one of my favorite addictionologists is Dr. Bowen from Virginia Beach. And he once described addiction as a disease of losses. And I couldn't put it any better than that. Someone who suffers from addiction, whether it's alcohol or other drugs, they lose their self-respect, they lose their family, they lose their job. Sometimes they lose their freedom and they're incarcerated. And eventually, what AA calls or NA calls that it's eventually going to be prison or death. And those are the outcomes for addictions in general. But it is a disease of loss.
And of course, you always hear the story that most people are in denial about having a problem, and oftentimes they have to hit rock bottom before they are taken to treatment or finally agree to go to treatment. So, yeah,
and you know, for some that's true, but I always like to think that people don't have to hit rock bottom. Sure. That we can intervene before people are there, and I think that's the value of shows like this, that are there to educate people, that if this is what's going on with you and you're concerned about your drinking, then this is the time to get help. You don't have to hit rock bottom.
Yeah, I agree with that, but unfortunately we hear more stories of the other. I think because people are uncomfortable talking about it, because it's still a stigma associated with it, and of course we know now it is more of a disease. There's a disruption in the brain chemistry in many cases. Do you want to elaborate on that?
Yeah, what we're finding is, I think in the past we've always assumed that if people were motivated for treatment, that they would do well and they would get clean or sober. But we're now realizing that relapse is much more complex than that. And what happens is when you have a pattern of using drugs and alcohol, the brain floods with a neurotransmitter called dopamine. And dopamine is the body's natural reward system. So when you take a walk with your husband or a friend, you have a little dopamine surge. When you have that chocolate candy, a little dopamine surge. When you watch your favorite movie, a little dopamine surge. But what happens with alcohol and drugs is that the dopamine receptor sites flood the brain with dopamine. So eventually what happens is the brain is hardwired to reward itself. And so the only thing that's going to create that surge is the drug itself, the alcohol or drug itself. So down the line, when that person is trying to get clean and trying to stay sober, that walk with his wife, that walk with her boyfriend is just not going to have the same dopamine surge, or the good meal, or the good book. What that says is it takes a while for the brain to repair itself. And they call this hijacking the dopamine reward system. Alcohol and drugs hijack the dopamine reward system, and they take over, and that becomes the only means of reward. So with studies with methamphetamine, for example, they find that it takes at least a couple of months before the brain can recover. So the good news is the brain can recover. But the news that we have to remember for people who relapse is this is tough. It's a tough road to hoe. And so when you get kind of frustrated with loved ones, or even frustrated with yourself, know that this is the brain that's basically hijacked this entire reward system. And you've got to allow for feeling miserable, and you've got to have a very strong support system to get through this.
I know, we'll talk about that when we get to treatment. That's a really key issue. Now, first, before we get into some other things, like risk factors and such, I know we had some statistics we wanted to how prevalent this is. And I imagine most people can say they know at least one person who's had a problem with alcohol, and it goes across the age span, etc. But I know I read a statistic about 1 out of 6 people in the United States have a drinking problem. Now, I guess that's all-encompassing, either a problem with abuse or dependency. And I know you had some numbers you wanted to mention.
Right. Well, we know 50% of Americans drink, and about 25% of those will become statistics and will have a problem with alcohol. We know that sometimes this happens in certain populations. Those numbers can increase 10 to 20 times with Native Americans.
Now, is that a genetic predisposition in that population?
That's kind of what they think, that there is maybe an enzyme missing, or something is going on. It's kind of the same thing with Asian Americans, but the flip side. Asian Americans are missing an enzyme which converts acetaldehyde. So they get this kind of flushing syndrome and an uncomfortable feeling, and they'll get a little bit red. And the thinking there is that when they drink and that kind of response or reaction happens, that then prevents them from drinking anymore. But I have to say, I'm also Asian American, and I lived in Japan, and I have seen many a drunk Japanese at the train station. So I wouldn't rely on some of that. The best thing you can do is educate and prevent. But we do have some general populations that are more at risk, yes.
And I know I was reading some statistics about 1 in 5 of alcoholics are young adults, and I guess college age and or younger. And we know we hear stories of young people that get into that cycle. They start drinking early and develop that dependence. And then the other interesting article that came out is that there's a new generation of binge drinkers, and that's 65 years of age and older, which I thought was quite eye-opening.
Yes. With our older population, and I was mentioning before that when I worked at Virginia Beach, we had a very large population of retired military. And many times what happens with retirees is they can kind of keep their drinking under wraps, so to speak, or they can function to a certain extent. So it's not as if they were not drinking all along. They were probably drinking and quite functional. But with the advent of retirement, and suddenly there's nothing to do and there's no plan in place, there's a resurgence in alcoholism, yes.
Well, doesn't that happen with retirement and or if people become depressed because they retire and they lose that purpose in life?
Yeah, you're mentioning depression, which is a very strong factor in substance abuse. We call those co-occurring factors, and depression or anxiety disorders or even attention deficit disorders are risk factors in terms of addiction and drinking.
And of course, even more severe mental health issues like schizophrenia and bipolar.
Yes. Now, what people don't realize is many of these disorders don't come or stand alone. That many times people have a coexisting or co-occurring disorder, and a lot of it, I heard another person just mention here in the studio, a lot of it is self-medication. That dealing with the hallucinations and delusions of schizophrenia, the drinking allows that to kind of dampen out. Same thing with anxiety, same thing with depression.
And I know one thing I wanted to emphasize, we were talking about that there can be a disruption in the brain processes and such. I mean, where are we in trying to get erase that stigma associated with alcoholism, that it's not a weakness or a moral defect? Similar to smoking. Smoking's a very strong addiction, and 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 it affects the brain and how things work, and that nicotine, same thing with alcohol. Right. So that's why I wanted to talk about that, to educate people that it's not a moral defect or weakness, it's a disease that needs attention.
And you said the magic word, it is a brain disease. And when I talked about in terms of relapse and the dopamine receptor sites, also the dopamine receptor sites shrink with the use of substances. And so they are no longer working at full capacity unless they get this drug again. Well, the other piece of it is that we're noticing that there's a lot more factors. There's some genetic pieces to this. There are some changes in the brain. There are some neurodevelopmental changes. And one of the largest studies that I'd like to mention is a Legrand study in 2003. And this is a Minnesota Twin Center where they studied groups of twins, and they're monozygotic twins, which means that they are identical twins and they share the same genes. And they studied twins from the age of 11 to 23 and 17 to 29. They looked at brain analysis, they looked at genetics, lab tests, they had a number of questionnaires, and they also did a number of surveys. And they followed this, we call this a longitudinal study, when you follow them over this expanse of time. And what they found there are some addiction risks, or what we call addiction vulnerable pieces to this. And one of them is if you drink before the age of 15. And they looked at men who drank before the age of 15, and 50% of these men were more likely to have a problem with alcohol addiction versus 19%. Similar statistics for women. So one of the factors is precocious drinking, or drinking before the age of 15. In the brainwave analysis, they noticed this P30, and P300, and there's a large brainwave, and it's called P3AR, and people who have this are also addiction or alcohol vulnerable. So that speaks directly to the brain. In terms of genetics, they looked at personalities. And we're learning more and more about genetics, that there's a strong genetic piece to personalities. And people who are risk takers, impulsive, extroverted, outgoing, are more likely to have problems with alcohol addiction. Now, having said that, I don't want you to run to the closet and hide your face, because we know that those very same characteristics are also present in firefighters, policemen, surgeons. So we wouldn't want to say that impulsive risk takers who are extroverted and social are problems, but they are a little bit more at risk than people who are calm, quiet, and more introverted. So that's an interesting piece. So personality, the brain wave, and the other piece that they look at is the precocious drinking. So we're learning more and more that this is not a disease that is simply just one of family dynamics. However, speaking of family dynamics, one more addiction vulnerable piece was when they looked at fathers who drank and were substance abusers. And they asked fathers who drank, what was the most you drank over a 24-hour period? And by that very simple question, they could look at things like tolerance, amount of drinking, pattern of drinking. So there are basically 4 pieces to that. So I think that kind of highlights that this is not about something, about a moral defect. This is not about somebody not being able to make choices. Yes, people make choices, but there are those things that are part and parcel of put you more at risk or more vulnerable.
I know I was doing some reading here, and it says how much you drink can influence your chances of becoming dependent. And it says men who have 15 or more drinks a week, women's 12 or more a week, and anyone who has 5 or more drinks at one time, at least once a week. So, and that just speaks to there's various patterns involved, because you hear stories. Some people drink every day. They come home from work and they start drinking, and they function at work fine. Then there's others that don't drink till the weekend, but then they binge drink. And of course, binge drinking is a whole separate topic, but...
Right. And you bring up a good point, Mary, that there are various kinds of alcohol addictions. I mean, for almost every patient that I've ever had, there's a different pattern. Some of the military individuals that I work with, they could be out on a ship for 6 months. But when they got back home, not only was the drinking irresponsible, but they couldn't predict how much they could drink. So perhaps when the normal person, I shouldn't say the word normal, but the average person goes out to a bar and he says, I'm going to have 3 drinks at this party, and then I'm going to have something to eat and come home. With a person who has an addiction, and specifically an alcohol addiction, that inability to predict is part and parcel of that. But so you look at what are the things you see in common? Tolerance, withdrawal, and the inability to predict your patterns of behavior. But other than that, there's a whole host of things. Some people are binge drinkers, but they're still alcoholics because there's that inability to predict how much you're going to drink or what's going to happen to you. There are people who drink only on weekends, but the pattern of drinking gets them in trouble. There are people, and I had a friend who never touched a drop during the day, but once she got off work, she was full court press. So there are numerous patterns of alcoholism and drinking.
And getting to that, what are the symptoms? I mean, how do you identify someone that has a drinking problem versus someone who's a social drinker? I know you said some of the things are drinking alone. Someone's not drinking along with a social event of some kind. Continue to drink even when they know it's affecting their job, family relationships and such. So what are some other things you might see?
You mentioned too, when you continue to drink despite problems and when you drink alone. Also, drinking to get to sleep is a problem. Drinking in the morning is a problem. Drinking that is not celebratory and drinking that's not with food. And those arise out of some studies in Europe. In Italian and Greek cultures, where drinking is usually celebratory with people, is much more predictive of healthy drinking or responsible drinking versus drinking alone or when you are trying to chase the blues. Drinking with food is much healthier than drinking without food.
Well, it slows the absorption and stuff.
Absolutely.
Because we do know there's lots of consequences to drinking if there's chronic problems.
Well, and also that drinking with food is seen that as part of the meal rather than a drug or something to make you feel better. And that kind of gets us back to looking at when we were in high school or when we were in college, what were the reasons that we drank? We drank to be disinhibited, to be able to put the lamp on our head or to be able to talk to that cute guy. Yeah, those are the, look back to the reasons why we drink. And those reasons don't exist when it's responsible drinking.
And obviously if someone becomes hostile or violent with their drinking, some people just seem to really have a strong reaction to it. I guess we're all wired differently.
Yeah, there is a simple questionnaire that physicians often use. Nurses and physicians often use it. It's called the CAGE questionnaire, where you can kind of ask yourself these questions. And CAGE is C-A-G-E. So the first question to ask yourself, have I ever made attempts to cut back? And that speaks to the kind of clarification that you know that you might have a problem. You're concerned, somebody's spoken to you about it, so you make the effort to cut back. That's always, everyone with an addiction, that's always the first thing they try to do is cut back on their own. And then CAGE, the A, stands for annoy. Have you ever annoyed anyone with your drinking? So have you, gotten your boss angry? Have you said words that you wouldn't normally want to say? Is your wife not talking to you? Is your husband not talking to you? So annoy. Then the G stands for guilty. And this is kind of the hallmark of alcohol. And you see this a lot of times in the movies. The person is drinking heavily, has made some stupid moves, have gotten themselves in trouble, and they wake up the next morning and they feel horrific. Physically, yes, but they also feel horrific internally and they feel guilty. And then finally, the E stands for eye-opener, morning eye-opener. Have you ever needed a drink in the morning just to get going?
But aren't there some people with drinking problems that lack that insight completely and just are in denial?
Yeah, and that's a good point. Denial.
I've not come across, people that say, well, I think I have a problem, I'm trying to cut back. My experience has been, they don't believe there's anything wrong with how they drink, their pattern or their amount, and they continue even in the face of their life crumbling around them. I guess, there's so many stereotypes to this, and I don't, you said it's just so individual to people as far as their pattern and problems.
It is. I think, though, that when you have a family member that you love and care for deeply, you're going to hit that brick wall, and it's called denial. And don't be a little bit fazed if they say you're the problem. You're the one that's angry. You're the one that's making a big deal out of it. Because what they will do is attack you. And that's part and parcel of that denial. And if we look at what denial does, if just look in your workplace or at your home, denial of a problem allows you not to have to work on that problem. And also not to have to face the consequences of that problem. That I didn't go to my son's soccer games. That I didn't show up at work on time. that I really lambasted that nice clerk at the grocery store. And so it's in many ways, denial is a protective mechanism. But one of the first things that will happen in treatment is that we will work with you through that denial, because it's what keeps you drinking. It's what keeps you in that kind of comfortable niche of addiction, which
Sure.
is not so comfortable after a while.
It's protecting your addiction.
Absolutely.
Exactly. Well, let's talk a little bit about screening versus diagnosis. And I know there's websites out there. I mean, you can just Google alcohol screening, and there's various websites where you just answer a set of questions, 10 or 20 questions, and if you answer yes to a certain number, then that could mean you have a problem with drinking. And then how is that different from diagnosis, and what's involved in the diagnosis of someone with an alcohol problem?
I think the screening tools are really great at taking a look at yourself or somebody else and being able to say, okay, this really is happening. And if you can get yourself into a treatment center, that would be the best way to go, is to have that insight. But the diagnosis comes when the physician sees you and he looks at what are the signs and symptoms, and then he's going to make a diagnosis based on DSM-4 criteria. Does he or she see withdrawal? Does he or she see increasing use or tolerance? Does he or she see a number of problems that are mounting that you're unable to deal with? So those are the kind of things that the physician or the healthcare professional will look at.
Well, I know, getting back to the screening, and you mentioned a lot of these, I found a 20-question instrument, and it touched on all these various things. Have you lost time from work due to drinking? Is it making your home life unhappy? Do you drink to escape? Do you drink because you're shy or you lack confidence? Is it affecting your reputation? Do you feel remorse? Do you crave a drink at a particular time of the day, every day? Financial problems as a result. So it's a lot of these type of questions. Difficulty sleeping, and I think that's probably common in the older adult population whose sleep patterns change, and they say, oh, I got to drink a few glasses of wine or whatever to fall asleep every night. So I think these screening tools are excellent. What I was really surprised is if you had 3 yeses to 20 questions or more, then that meant you should probably seek out an evaluation. So
absolutely. And I think the other thing to that is that a lot of times my patients will really try to get sober on their own, but it's really hard. You really need some medical treatment. When you have the onset of withdrawal symptoms, the physician and the healthcare professionals that are there at the treatment center can begin a series of strategies. One of them is medication to help with that withdrawal. We don't want to see you get worse. We don't want to see you go into seizures. And that can happen with somebody who just tries to stop cold turkey.
That's why you shouldn't do it yourself at home, correct?
You know, it's people have been known to do it and have survived, but I would say, no, the treatment program is the best way to go.
And that is, when you say treatment, I think we should clarify, that first 5 or 6 days or so, that's called detox.
Right.
Where you have that very high incidence of having seizures or going into some severe physical withdrawal symptoms. It can be life-threatening.
Absolutely, Mary. And sometimes individuals will try to kind of be strong and work it out on their own, but they'll have horrible anxiety. They'll have night sweats. Their blood pressure will become dangerously high, and their pulse will become dangerously high. So that is why we really want to get you in a treatment center. But having said that, when you said the word detox, I think that's another important part of the picture, that detox is simply the first step. It's a first step of treatment. A lot of patients think that if I just get myself in a detox and get clean, I'll be fine. But think about that. Detox is 5 days of clean time. We're looking at the rest of your life. So you need to get started on some kind of treatment program after you leave the hospital. Sometimes there'll be partial programs, and I strongly encourage people to check out AA, check out NA, Al-Anon, Alateen. They are successful 12-step programs, and what the wonderful piece is, everybody there is just like you. They've all had this struggle. They're doctors, teachers, nurses, and
crosses the gamut of
Crosses the
socioeconomic
gamut.
status
Absolutely.
and everything. I know
Absolutely.
it's amazing. I've learned a lot about this through some acquaintances with struggling with this, and it's quite eye-opening. But you go there just like any support group, and you're with people that are struggling with the same issues and can support each other. But some people require inpatient treatment, don't they? I mean, I know there's
Absolutely.
facilities out there that do detox plus you stay and do a 30-day, treatment
Right.
program.
Right. And 30-day programs are ideal. Even 60-day programs are ideal. And some of those are the famous clinics at Hazleton or Betty Ford. But part of that is going to depend on your insurance and what you can pay for. But it won't hurt to make that phone call and try. Because another day living with addiction is another day closer to death.
I know you were mentioning before the show that alcohol is probably one of the worst substances in terms of its effect on the body, and I think everyone knows it can cause liver problems, cirrhosis, and liver cancer and various liver issues, but you're saying it affects the brain, the heart.
The heart, absolutely. When we think of addictions, or we think, oh, the heroin addict must be the worst, but actually alcohol is one of the worst substances you can ever think of taking, and alcohol addiction is one of the worst on your body. You can develop cardiac myopathy, which is an enlargement of the heart and the weakening of the heart. You can develop esophagitis, which is an inflammation of the esophagus. You can develop pancreatitis. The famous one is cirrhosis of the liver. Leading cause for cirrhosis of the liver is alcoholism. And that means the liver is enlarged. There are fatty deposits on the liver. They increase the white blood cells, but more importantly, the liver can no longer do what it's supposed to do.
And it does a lot of things.
Does a lot of
things.
Yeah,
And,
I mean, detoxifies everything we take into our body. Other things are the brain as well. Wernicke's encephalitis, which is due to thiamine deficiency, and also Korsakoff's. And these two together affect your recent memory, affect your posture and your gait. You may have seen an older alcoholic that walks like this.
Because it affects the nerves in the feet too,
Affects the
doesn't it?
nerves,
Peripheral
the
neuropathy.
feet, the muscles around the eye. So there's brain damage as a result of alcoholism.
And of course we know how it can destroy lives and families, and of course when people drink and are irresponsible and drive and can hurt themselves or someone else. I mean, I think most people are aware of all these implications, but I think most people, unless you've dealt with it, are unaware of the tremendous impact it has, not only on the person's physical body, but on the family, and that's why treatment's so important, and not waiting till they get to rock bottom to approach them on it.
Absolutely. And I think when you're a family member, most of the time family members live a long time with this. And they spend a lot of energy trying to protect the person and calling the boss when he can't come in, or making sure the bottles of wine aren't there. And rather than use up a lot of your energy trying to protect the person, go to Al-Anon, go to some of the support services, because those things can actually just prolong the alcoholism. It's important to get that person in treatment.
Now, we talked about detox being the first 5 days or so, and then usually a treatment plan, inpatient. Now, not everyone has to do inpatient, but there's certainly a lot of outpatient programs, and that's a separate issue from AA. You go to an outpatient treatment center where you go there almost every day, I imagine. You need that early on, and then the AA meetings, you can go to those 2 or 3 times a day, I believe, if you really want to early on.
Right.
So maybe explain that briefly, the concept that they have that 12-step program. What's involved in that besides the whole abstinence, where you just can't drink anymore? And is that the current thinking, that abstinence?
It is, and there are several kinds of ways to go to treatment. My recommendation is that you go to inpatient treatment, because you really needed to be treated for withdrawal. And sometimes those will be the 5 days detox. And many treatment programs also have supportive programs which will last longer than the 5 days. Outpatient treatment, solely outpatient treatment, has got to be closely monitored, because you're at risk at developing seizures and other problems. So if you are in an outpatient treatment program, it has to be closely monitored, particularly when you're on medications. The other one is, you mentioned AA, and AA is really a support network. Many of my patients, they have meetings several times a day, every single day of the week, including Christmas and Easter. So there's really no reason not to go to an AA meeting.
And you can find them anywhere.
Absolutely.
I mean, if you travel, I mean, I know some people that wherever they go, they find out where the AA meetings are because they're committed to the treatment plan.
Yeah, and Google it online. You'll find where the AA meetings are, and some are open and some are closed. The open ones, anybody can come in. The closed ones are people who go to AA. When I say open, I mean like maybe physicians or family members can come. Closed means that only the person themselves can come.
So Judy, if a family is in the throes of, having a person with an alcohol addiction, in their household, and they're realizing it's a significant problem, what should they do? I know we've heard terms like, an intervention. What are some things a family member can do? Or, we'll talk about resources as well a little later, but just tell us, what a family can do to address the problem.
Well, they have to address a problem with the individual, and they have to be clear. They have to be honest, rather than use statements, you do this, you do that. How does it make you feel? For example, I feel left out when you're at the bar all day, when you're not there for the kids. But the bottom line is this is a person's addiction. And sometimes you have to allow the person to take the consequences of their actions. What do I mean by that? Making excuses for the person.
So don't do that.
Don't make excuses.
The enabling
for the person.
thing.
The enabling thing, exactly. Allowing the person to have to deal with some of the consequences of their actions. Sometimes it may even be jail time. It's not absolutely bad. There are wonderful things called drug courts, where they have things in place to help the person with an addiction. Consequences have real meaning for the client, and particularly when you talked about being in denial, that denial is so strong. And sometimes it's the consequence itself that makes the door open for them. So the wife threatening to leave, the husband threatening to leave, losing the kids. Those are very real consequences that may then motivate that person, be that external factor that makes sobriety a possibility.
Taking away the keys too, if there's any
Taking away
concern
the
they
keys.
could drive. I know that's a serious issue. Now, an intervention, does that mean you get a group of people together if you feel like you can't do it alone? Mm-hmm. You want to confront the person, say, we need to go and get you into a treatment center, and you bring several people together to address it with that person. I mean, are they effective?
Yeah, they are. And you see that in TV where they have family members, particularly when you take kind of a risk when you address a person alone, because they're going to say something like, well, you're the one that has a problem. Nobody else has a problem with me. I only drink sometimes or on weekends. When you have a number of people, this really brings to the fore the enormity of this problem for many, many people across the board. So interventions are great, but the bottom line is this person has to be motivated. This person has to want to get clean and sober. But you can certainly get those things in place. But it might be that you have to protect yourself, and you have to leave the marriage. You have to lose a friendship. You have to say goodbye. And you've got to protect yourself, and that's why Al-Anon resources like Al-Anon are very good.
I know I've heard of instances where you say let them hit rock bottom sometimes, and that may mean they get so physically ill from drinking that 911 has to be called and they get to the hospital. But you're right, they have to consent to that next level of treatment, the detox and the inpatient treatment.
Right.
And of course, Al-Anon, you say, is a very helpful resource for families, even before they address it with the person.
Right.
Maybe get the strength to be around other people
Great idea.
that have been in this situation that can maybe give them some advice.
Yes. Great idea, and it keeps them from doing this blame thing that family members often do. Well, if I'd only been a good kid, if I'd only gone to college like my dad wanted me to, And it keeps the family member from staying in that blame place and allows them to really see the addiction for what it is.
And I think just being educated about the fact that it is a disease. It's not a moral weakness, it's a disease, and it needs to be addressed like a disease, and that involves abstinence and support.
Right. And I'm glad that you said abstinence, because that's where we're going when we think about treatment. Some people sometimes think that they can go back and drink responsibly. And that's a very, very
slippery slope, I'd
yes,
say.
it is. It is. And there have been numerous studies that have tried to create programs where people can drink responsibly. And certainly there are people who have been able to do that. For the most part, what we say is abstinence, abstinence, abstinence.
I was telling you before the show, I call it the one drop theory, you know, just not even a drop, because that can just start that reaction of, I got to drop, I'm going to just keep drinking, and they can't stop, and starts that cycle over again. I've seen it happen.
And nobody wants to see that person out there. Nobody wants to see that person suffer. So as much as possible, if it means they can't go to the family Christmas party, fine. That person has to protect himself and not be in the environment where he's going to be at risk. I've got clients who will not walk into, back home, we have a Harris Teeter where the wine is up front. And they won't go into a Harris Teeter, but they'll go into a Food Lion where the wine is not up front. Or they won't go into a 7-Eleven. You've got to do those things that protect yourself.
What's your philosophy on, say, once a person's in treatment and recovering, and it's a recovery process, it's not a cure, it's every day, I'm not going to drink today, that's what we hear. Can family members still drink around that person, or should everyone just abstain and make that person, feel more comfortable about it?
Right. I think it depends on where that person is in their recovery. If they're brand new in their recovery, I would really take care of that person, and I would really not put them in harm's way. If they've been a year or even less, down the road, if they've been a while down that road, maybe not so recent, then they have to kind of incorporate those lessons for themselves. They're going to be invited to a bar, so they know how to say no to going to a bar. They actually will change their group of friends. Alcoholics and addicts actually have groups of friends that support that activity. And you'll find that AA has a phrase for this. They call people, places, and things. They will have to change the people, places, and things that they go to. So, they're going to the library, or they're going to another group or a function, or maybe a band, rather than the bar or the restaurant where there's a bar that they used to hang out. So those are kind of things that they have to have in place.
Well, it does require developing that internal core of control, because alcohol's everywhere. It is fairly pervasive, so you're going to be exposed to it. So I guess that whole treatment program focuses on that in the AA meetings, I imagine.
Right. And it's kind of interesting that you said the word control, because one of the hallmarks of AA is recognizing that you're powerless over this disease. And that's really hard for clients, because one of the things that keeps them in trouble, they think they can kind of handle this and they can take care of their alcohol drink, and they can, and one of the things that we have to teach our clients is that you can't. It's not something that you can handle. So you have to avoid people, places, and things.
And the other key point of that is that the sponsor program, is that pretty prevalent? That
Good point.
You're assigned a sponsor that you can call?
You're assigned a sponsor that you can call at any time, and he or she will say, let's go have coffee. And what the kind of exciting piece about that is much of the research indicates that support is the number one reason people stay clean and sober. So that support network is AA, the family, as much support as they can have. That seems to be the number one factor in keeping them sober.
Well, that's the case with a lot of addictions. I know I read in smoking, you just can't do the Nicorette gum and all. You need to have the support piece to really help you fight that addiction. So I think that's real important. And you're saying Al-Anon and other groups and such can be helpful.
Right. And I'd like to just add one more point, is relapse is part of addiction. And don't get too frustrated when your family member relapses. And if you yourself are the one struggling with alcoholism, relapse is how, and one of my own patients said it best to me. He said, Judy, I learned something new from every relapse. So to say you can have only 3 relapses or one treatment and that's it. That it is a disease of relapse, and every relapse there's a lesson to be taught. And we don't want to see anybody relapse. And the plan is that you don't relapse. That's what sobriety is about. But don't get too frustrated as a family member or even as a person with this illness when relapse occurs. It does occur, and the bottom line is to get sober again and learn the lesson from that relapse so it doesn't happen again.
Right, right. I know with smoking, everyone knows you have to usually take several attempts to quit.
Absolutely.
And the same with alcohol. It's a very powerful addiction.
Yeah, that's a good example.
It's true. Well, there's some great websites out there,
Okay.
and we're going to post those at the end of the program. Obviously, the National Institutes of Health has National Institute on Drug Abuse, and then there's also the National Institute on Alcohol Abuse and Alcoholism, which is very specific to alcohol addiction. And we'll post those websites at the end of the program. And the other thing I wanted to mention, I had a friend ask me, do you know where there's treatment centers? Well, there's a website I found called Alcohol Screening that not only has the screening survey identifying if you have a problem, but they have a map of the United States, and you can click on the city or town or type it in, and it'll give you all the treatment centers and resources in that area. So I think the information's out there where people can get help, so I think that's real important. And we'll also post some places in the local area where people might be able to get help. And I know you brought a list of them. So
Absolutely. Super.
Well, thank you so much, Judy, for being on the program and talking about this tough topic.
Thank you.
But
Thank you for
important
having me.
nonetheless.
It is.
And thank you for joining us for this edition of Focus on Health here on PAC 14.
Focus on Health is sponsored by Peninsula Regional Medical Center, a proud supporter of PAC 14 programming.